Good evening. I will now call to order our meeting today for the Allegheny County Board of Education, Tuesday, November 9th at 5:08 p.m. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This time, we'd ask that you please join us in a moment of silence in remembrance of Fort Hill student Saquon Jenkins. Thank you. This time, Mr. Llewellyn will read closed session summaries from executive sessions held on October 12th, 2021.
The Allegheny County Board of Education met in closed session on October 12, 2021 at 3:30 p.m. at Mountain Ridge High School. The purpose of the closed session was to discuss personnel matters, consult with legal counsel, consider matters related to collective bargaining, and to engage in administrative function. All 5 board members were present for the meeting. The meeting was closed under the provisions of the General Provisions Article, Section 3-305B1, 7, and 9. The topics discussed were Memorandum of Understanding with ACEA, screening employees/athletes, medical marijuana, board communication policy, and locker usage.
Thank you, Mr. Llewellyn. Consent agenda. Is there a motion to approve the consent agenda?
Make a motion to approve the consent agenda.
Motion by Mr. Farrell, second by Dr. Bond. All those in favor? Motion passes unanimously. Thank you. Moving on to our superintendent's report, I believe we'll be getting an update from Ms. Mayer and Dr. Corder.
Thanks for having us. Can you hear me? Okay. Oh, you can? Okay, good. All right, I'll go ahead and get started. Thanks for having us today. We just wanted to give an update about COVID-19 in Allegheny County and also talk about the vaccine for 5 to 11-year-olds. So in Allegheny County, right now, our case rate is at 18.87 cases per 100,000 population. That compares to 11.54 in the state of Maryland. So as you can see, we've come down significantly since this time in September. In mid-September, we were in the 60s and 70s, and now we're at 18.87. Our percent positivity has come down as well. In Allegheny County, we're at 4.6% compared to 3.1% in the state of Maryland. And what that measure means is of all of the testing that goes in for Allegheny County residents, what percent comes back positive? And right now, we're 4.6%. As far as our residents who are fully vaccinated, we are at 46.9% of Allegheny County residents fully vaccinated. In Maryland, that number is 67%. For individuals ages 12 to 17, we're at 33.4% of residents fully vaccinated compared to 66.6% in Maryland. And when we look at kids 12 to 17 who've had at least 1 dose, we are at 38.1% compared to 75.6% in the state of Maryland as a whole. The next image I have for you is our case rate, and you've all seen this before. So we see the large peak that we had last year in the fall of 2020. And you can see a significant decline since September in Allegheny County. Allegheny County is that yellow line, and Maryland is the blue line. The next image is the COVID data tracker. So this is looking at community transmission, labeled as high, substantial, moderate, or low for each individual county. And we are still in the high community transmission area in Allegheny County. All of Western Maryland and a lot of the Eastern Shore are in the high category. Only Montgomery County is in moderate, and that's not surprising because the vaccination rates are very high in Montgomery County, and vaccination rates are much lower in Western Maryland and the Eastern Shore. And I'll turn it over to Dr. Corder to talk about children and the 5 to 11 vaccine.
Okay, I hope you all can hear me okay. If you can't, let me know. But the first thing I wanted to do was just summarize Janelle's stats that she just shared with us. The graph is definitely good news that our case rate is going in the correct direction, the direction that we want it to be. But prior to that, she did emphasize that our vaccination rates remain lower than we would like them to be. So it's with caution that we celebrate this direction of the curve because we know we're under-vaccinated, and if not for the active practice of the other mitigation strategies that you see here even tonight with masking and distancing, it would be different. So it's nice to have some good news, and we will take it. The subject I wanted to briefly review tonight was concerning COVID-19 in children in general, and then in the 5 to 11 group in particular, because this is the group that we've just begun vaccinating, the 5 to 11. So there has been a myth that exists regarding COVID-19's impact on children, and this myth trivializes the effects of COVID-19 on children. It minimizes the effects. And early on, when we were doing less testing of children, we're still under testing children and under documenting their conditions, but we have learned a lot more. And the fact is, the impact of COVID-19 on children is great, not small. Just to list a few of the conditions that will be commonly seen after a COVID-19 infection in children, if you are symptomatic, breathing problems would be number one on the list. As you all know, the virus mainly affects the lungs, the respiratory system, and it can lead to breathing problems, low oxygen, breathlessness. Of course, if you have something like asthma pre-existing, then these breathing problems would be something that we commonly see with COVID-19. The second thing is cardiac issues, or the heart muscle itself. COVID-19 is a virus that is what we call a systemic infection. When it affects us, it goes throughout our bodies. And even when we have no symptoms, this happens. It travels throughout. It can affect any system. And we know that the cardiac system, the cardiac muscle, is impacted commonly with COVID-19. In adult studies, they have found that up to 60% of adult COVID-19 patients have had some degree of inflammation of the cardiac tissue. This is exceptionally high. There are other viruses in the world that we can get, such as influenza, that also can cause cardiac issues. But this is something in the medical world we are familiar with, but the general population is not. So the message is cardiac issues are not uncommon in people with COVID-19, including in children and teens. Any kind of risk of a very low risk of getting a mild myocarditis from the vaccine is exceptionally low compared to what can happen with disease. Smell and taste are often affected in children with COVID-19. Of course, this can not only lead to decreased ability to enjoy food and all, but it can also affect mood. It can also lead to situations where danger could be present when you cannot smell a dangerous smell. And about 1/4 of teens will develop problems with smell and taste when they get COVID-19. So developmental issues cuts to the fact that, again, the virus is systemic and it can affect the brain. It can affect the central nervous system, and it can manifest in problems with attention, speech, even cognition and learning. So these are problems children see after infections with COVID-19. Mental fatigue would include what adults have termed brain fog, problems with concentration and memory. Children also describe this. Physical fatigue, of course, we would see that considering the fact that our lungs are affected and our oxygenation is affected, along with the other organs that are impacted by COVID-19. Headaches are a common symptom of COVID-19. Even in mild cases, headaches are commonly described. Mental or behavioral health impacts because of COVID-19 are also common. The time children have to spend in isolation, away from school, if they get quite sick, the time in hospital is frightening. So especially children who have pre-existing mental or behavioral health concerns, this can be a huge impact on children. The multi-system inflammatory syndrome in children is well described, and it is less common, but this is a highly dangerous condition that will occur a couple weeks after the COVID-19 infection itself, and frequently leads to ICU admissions and has a fairly high mortality rate if that happens. Finally, I'd like to just mention long haul COVID-19, which is when a person who has been infected and acquires COVID-19, maybe they never even had symptoms acutely, or maybe they've recovered from mild symptoms or moderate symptoms, but later afterwards, the symptoms return. A month or more afterwards, symptoms return. The fever, the headache, the fatigue, the brain fog. This occurs in children too. So the myth of yesteryear that the impact on children of COVID-19 is small should never be repeated. We have to acknowledge the impact is great. We shouldn't diminish it or minimize it. Now, talking specifically about 5 to 11-year-olds, this data comes from the CDC, and in that cohort alone, there have been almost 2 million, over 1.9 million cases of confirmed COVID-19. Of those, there have been around 8,300 hospitalized 5 to 11-year-olds, and about a third of those required ICU admission. Over 2,700 5 to 11-year-olds have needed to spend time in an ICU. Of those, 94 5 to 11-year-olds have died. That's current stats on just the 5 to 11-year-old cohort. And if we wanted to talk about all of the pediatric age range, the numbers would obviously be a lot larger. But it's significant numbers and scary numbers. Not everybody here is a predictable patient for a bad outcome. In other words, about a third of these people were completely healthy before they had moderate or severe disease. The last thing I'd like to mention is really the benefits of being fully vaccinated. We have a very safe vaccine available now to us as young as 5 years of age. Children who are vaccinated in the clinical trial for the 5 to 11-year-olds, what we know is of those children, each child who was fully vaccinated is 90% less likely than an unvaccinated child to acquire symptomatic COVID-19. So the list of the conditions that happen with COVID-19 that we now acknowledge occurring children will not occur. We're 90% less chance of any of those occurring in the child who is fully vaccinated. So the reduced risk of symptomatic disease means fewer hospitalizations and fewer long-term effects. We also have a reduced chance of spreading COVID-19 to others if we're fully vaccinated. And of course, children who are fully vaccinated can avoid quarantine when they are exposed to COVID-19 and they have no symptoms. They can maintain attendance at school, extracurriculars, play dates, and things like that, family events, when they have no symptoms when they're fully vaccinated. So I think the only other thing to reinforce is something I've said before, which is that it's definitely safer to get your immunity through vaccination. No question about it. And if you don't get your child vaccinated or yourself vaccinated, it is absolutely true that you will get COVID-19 eventually and hopefully have a mild case. But there's no guarantee. The safest way to get immunity, because you will get immunity one way or another, is through vaccination. So we're happy that we're have started vaccinating 5 to 11-year-olds, and we welcome them all to the clinic and also access to other places. I know that Janelle wants to mention a few of those initiatives now. Thank you.
Thanks, Dr. Corder. So as Dr. Corder mentioned, it's a very hopeful time. Now parents have the ability to get their 5 to 11-year-olds vaccinated. And Allegheny County Health Department, in partnership with Allegheny County Public Schools, is offering after-school vaccination clinics. That information went out through the school system to parents. We had one yesterday, we have one going on right now, and they filled up very quickly at South Penn and Mountain Ridge, so we were very happy to see that. We're vaccinating not only kids 5 to 11, but also providing booster vaccines for school staff. So that's teachers and cafeteria workers and bus drivers. They're all eligible for Moderna boosters. So we have Westernport tomorrow, and then next week we have Flintstone and Cresaptown Elementary. And we are looking at, because our clinics filled up very quickly, we are looking at adding an additional clinic to give parents another opportunity to get their children vaccinated. I also want to add that we are not the only option to get your child vaccinated. If they're 5 to 11, the local pediatricians are also providing Pfizer vaccine, as well as several local pharmacies. So does anybody have any questions for me or for Dr. Corder?
Dr. Bond.
This is for Dr. Corder. What is the percent of serious side effects in that group? You said that there is a percent of myocarditis or serious side effects. What percent of the children in that group actually develop those serious side effects? I mean, when I'm looking at this and it says cases of 1.9 million, 94 deaths, that's a death rate of 0.005%. So how much more, what's the percent of damage or side effects from the vaccine?
Oh, from the vaccine. Well, in the clinical trial.
That's interesting.
I guess you call it that.
We lost power here,
Hold
Dr.
on one
Corder.
second, Dr. Corder. Hold on.
We're in the dark here. Hang on a second.
Oh.
We're back. Sorry about that. If I caused that, I'm sorry.
Okay, so I'm back on.
Yes.
So I do have an echo, but I'm going to try to talk through that echo. The clinical trial for
sorry?
this phase, the clinical trial for this particular phase for Pfizer product included about 2,500 or so children in the clinical trial. During that time, they did not see any cases of myocarditis at all. Now, the formulation for the 5 to 11-year-old is different for the 12 plus. It's a smaller dose. It's a third of the dose. And it created an immune response that was equivalent to the higher dose in the older population without, at this point, we're hoping that there'll be fewer side effects. However, the side effect profile is expected to be similar. A sore arm, maybe a fever, maybe some fatigue, redness in a sore arm, that
had
kind
mentioned-
of thing.
Excuse me, you had mentioned, though, that the MISC had a very high mortality rate if they contracted that or had that as a
Yes.
as a child. So that isn't reflected, though, in the data. Like if the
You
high
mean from
mortality
natural
rate,
and-
I'm just trying to see, what if the risk, the impact is small but does exist of being vaccinated. What is that risk when you had
This
mentioned
is
the high mortality rate?
I'm sorry, my list of things is not the impact of being vaccinated, it's the impact of getting disease.
But then again, if they got the disease and there's a high mortality rate, are you saying that they're not getting that because in the 2,500 in the sample, there weren't any significant cases of side effects? Is that what you're saying, because it's a
So-
reduced dose?
Well, the reduced dose makes it's logical to go with that's how they designed the trial. It's logical, and they did find good immune response. So that's the biggest point. They wanted safety and efficacy are the main things what they're looking for. So in terms of safety, the vaccine did cause local side effects, like I mentioned. But in this trial of only 2,500 people, they did not, for the ones that got the vaccine, they did not identify any myocarditis. The myocarditis, or the cardiac inflammation, seems to be occurring. When it occurs mildly and mostly in the older teens and young adult males as a preferential thing. And when you go down and look at 12 to 17-year-olds, the younger you are, the less likely you are to have myocarditis. So we're inferring that it's going to be less likely in the 5 to 11s. In addition, they get a smaller dose. But the point that needs to be made is that anytime we're starting out under an EUA situation, emergency use authorization, as opposed to a full approval of any product, that means you've started off studying it in a certain smaller population than you're going to be using it in the real world. So now this week in the real world, we are starting to vaccinate 5 to 11-year-olds. We have processes and platforms set up to follow and to report the side effect profile in 5 to 11-year-olds. The V-Safe is something many people will be familiar with who are vaccinated, that there's a texting, CDC texting a massive crowdsourced reporting of side effect profile. So there's also the VAERS reporting system. So as this is rolled out on a wide scale basis, we would not be surprised to see some rare side effects that may occur. Because it's happened in some older groups. So we're going to have to just see how often that is. We don't know that right now because all I know is in that study population, they didn't have any myocarditis.
So the 2,500 sample is, as you said, small, but the actual number of cases is 1.9, and the total percent of need for hospitalization, including the ICU admissions, was 0.43%. So that seems pretty small to me.
Well,
all I
unless
got.
it's your child.
Well, I mean, there's a lot of other things that can happen to a child, too. That was all I was
Well, we
gonna-
put them in
thanks.
seatbelts, right? We put them in seatbelts, right? So I don't want to go down that rabbit hole of looking at that number and going, oh, only 94 kids died of a vaccine preventable condition.
Well, that's yes and no. I mean, I can sit here right now and tell you 4 or 5 people that I know personally that died with the vaccine. They contracted COVID and died. So,
Yeah, and I would, if we wanted to one by one talk about who they were and their comorbidities, but that's not for our talk right now. But this is not doing anything is your option if you're suggesting that, and not
I was
doing
not
anything
suggesting
is-
that. I just want the information out there. That's all I'm suggesting. That's all I was wanting.
Okay.
I appreciate that. Thank you.
Yeah. Okay.
Ms. Fraley has a question.
I would just like to acknowledge what she stated in the beginning, that we need to acknowledge there was an impact regardless of how big or small it was, and we don't need to minimize it. And as educators in the school board, our job is not to say whether a vaccine is necessary or not. That's what medical professionals are for. And we're here to just know that what this can do to children and what we should do as far as within our school system. And I think that we need to be more cognizant of the fact that people aren't going to be coming and listening to a school board meeting to find out the facts about a vaccine. So let's not argue something that we don't have the knowledge to argue, nor is it our purview to argue.
Are there any other questions for Dr. Corder or Ms. Mayer? Okay, thank you both very much.
Thank you. Thank you.
Oh, okay, we're going to be down just 1 minute while we reset the microphones.
We'll have to do that. We can't restore their system, so we hear you online and everything else. But yeah.
Talk.
Okay. At this time, Dr. Bond will present a proclamation recognizing November 15th to the 19th as 2021 American Education Week and also November 17th as Educational Support Professionals Day.
Allegheny County Board of Education Proclamation. Whereas public schools are the backbone of our democracy, providing young people with the tools they need to maintain our nation's precious values of freedom, civility, and equality. And whereas by equipping young Americans with both practical skills and broader intellectual abilities, schools give them hope for and access to a productive future. And whereas educational employees, be they custodians or teachers, bus drivers or librarians, work tirelessly to serve our children and communities with care and professionalism. And whereas schools are community linchpins, bring together adults and children, educators and volunteers, business leaders and elected officials in a common enterprise. Now therefore, we, the Board of Education of Allegheny County, do hereby proclaim November 15th to 19th, 2021 as the 100th annual observance of American Education Week, and November 17th, 2021 as Educational Support Professional Days. Signed by Crystal Bender, President, Board of Education, Jeffrey S. Blank, Superintendent of Schools. And that's for our President of the local ACEA, Ms. Sloan. Congratulations and thank you.
Thank you, Dr. Bond, and just members of the board for that recognition of the hard work and dedication of our ESPs here in Allegheny County.
You're welcome.
At this time, Ms. Sloan will recognize the ACAA Educational Support Professional of the Year.
ACEA is an association of both certificated educators and ESPs, or education support professionals. Our ESP colleagues provide a variety of supports for both our students and certificated colleagues. They are our instructional assistants, secretaries, and information technology technicians in our association. Yet there are still others, such as nurses, custodians, maintenance, food service workers, and bus drivers, without whom we could not successfully meet the needs of our students every day. While ACPS hosts the ACPS Teacher of the Year, ACEA wanted to complement this and recognize the contributions of our ESPs in a similar manner, and thus established the ACEA ESP of the Year program in 2015. When nominated for this honor this year, Shelley was working as an instructional assistant extraordinaire at Westernport Elementary School. Since receiving this honor, Shelley has expanded her ESP experience and accepted a position as the school secretary at Westernport Elementary. This evening, I am pleased to present our 2021 ACEA Education Support Professional of the Year, Mrs. Shelley Fitzgerald. Congratulations.
I have about a half an hour speech. Is that okay? No, I'd like to say thank you to the board. I'd like to thank you to Ms. Sloan, Missy Keeley for nominating me. It was very humbling. I have been a bus driver. I've been a substitute cook. And the last 16 years, I've been an instructional assistant at Westernport, which has become my family. The kids are my reward each day. If you have a rough day, go in and see your students. They'll bring you up. And if we could live in a world where we were like these children who accept and love unconditionally, it'd be a much better world. So I just want to say thank you. I thank you for Mr. Horn, Ms. Fazenbaker, who was my principal, Mr. Stein. I've worked under Mr. Nickel, Mr. Carter. It's been a wonderful career, and like I said, it's humbling, and I thank you very much.
Congratulations, Ms. Fitzgerald. Thank you, Ms. Sloan. At this time, we will move into unfinished business. We did not have any constituents sign up to speak this evening. Mr. Llewellyn?
Yeah, before you for second reading, policy BCA. This is the ethics policy. After a lot of discussion last time, it passed on first reading. The only thing that was added to the policy was the 3 words at the top under purpose that is in yellow, and we also updated the statutory reference in the policy. And so you pass it tonight, then it passes on second reading.
Is there a motion to approve policy BCA?
So moved.
Motion by Mr. Farrell. Is there a second? Second. Second by Dr. Bond. Any discussion? All those in favor? Motion passes unanimously. Thank you.
The next policy you have before you for second reading is the nepotism policy. Last meeting, it was passed as amended. So you'll see on this version of the policy, Section F under standards has been put back in, and otherwise we've updated the policy to match the qualified relative definition, to match the board's ethics policy. If you pass it tonight, then it's enacted on second reading.
Is there a motion to approve second reading of policy BCC? Motion by Dr. Vaughn, second by Mr. Farrell. Any discussion? Ms. Fraley?
I would just like to note that I would still believe that we should have the definition of nepotism, since the policy is entitled nepotism, to ensure that the definition of nepotism is known to those reading the policy.
Any other discussion? Okay, motion and a second. All those in favor of approving policy BCC? Opposed? Motion passes 3-2. Thank you.
The last one for second reading tonight is GBEA. This is the staff ethics policy. Again, when we were going through the different ethics policies, we recognized that the discrimination language in this policy was not up to date with our other policies and state and federal law. So we're just adding language to bring it in line with the other anti-discrimination language we have in those all of our other policies.
Motion to pass second reading of file GBEA.
So moved.
Motion by Ms. Fraley. Is there a second?
Second.
Second by Ms. Frank. Any discussion? All those in favor? Motion passes unanimously. Thank you. At this time, we'll move into new business, and I will turn it over to Mr. Blank for reopening plan recommendations.
Good evening. Before we begin the new business for reopening plan recommendations, I'm going to call upon Tracy Leonard, our supervisor of PE, to give us an update over our fall and extracurriculars and where we stand at this point.
To present a fall athletic update this evening. MPSSAA state playoffs are in full swing currently. We have both Allegheny boys and Mountain Ridge girls soccer teams in the state semifinals. That will be played this Saturday, November 13th at Northeast High School in Anne Arundel County. The Fort Hill, Mountain Ridge, and Allegheny football teams will be playing in the Region Round 2 games this Friday, November 12th. The winners of these games will continue on to the state quarterfinal round. The Fort Hill and Mountain Ridge volleyball teams will be playing the region final tomorrow night at Fort Hill High School. The cross-country state meet is to be held on November 13th. We have one team, the Mountain Ridge girls, that have qualified, as well as one individual girl from Allegheny and an individual runner from Mountain Ridge. Golf has already wrapped up, and we had one representative from our area. Darian Bauer finished 13th in the state championship meet for Allegheny Golf. Just to clarify, the volleyball region games and the state quarterfinal games, the tickets will be available at the gates. The region round 2, the state quarterfinal, the state semifinal, and state finals in football, as well as the state semifinals and state finals in soccer and volleyball, all those tickets will need to be purchased online. This is a new thing that MPSSAA has just started this year for the fall sports. So no tickets will be sold at the gates for those games. To purchase tickets, please go to tickets.mpssaa.org. Also, you could call a school or one of the athletic directors and they can help you out with ordering your tickets online. Of the 258 games that have been scheduled to date, 225 games were played as scheduled. Another 17 games were able to be rescheduled. So 93.8% of the games scheduled have been played in this fall season. We only had 16 games that were unable to be rescheduled. A huge note of thanks goes out to the athletic directors, the school administration, and coaches for working hard and being very flexible in the rescheduling of athletic contests. And as always, a thank you to the parents and guardians and the student athletes. We have had a very successful fall sports season. With that being said, winter sports is right around the corner. The first practice date is Monday, November 15th. Our first play date will be Monday, December the 6th. Right now, we have 292 games scheduled for our winter sports season.
Thank you for the update, Mrs. Leonard. At this time, I'd like to make a recommendation from our staff to the board members with changes in the reopening plan. The first recommendation will be for buses. We would like to treat buses as we do classrooms, and that's something that we are able to do, able to change that. So I'll put all these together so it can be one recommendation. So that's the first phase, that buses are just like classrooms. If you're within 3 feet, that's the only time you have to quarantine. So we do not have to quarantine if you're in different seats, so if you're side by side. Face coverings can be removed while a student athlete is actively participating in their events. Face coverings are required for athletes and coaches in the locker rooms and while on the bench. All spectators must wear a face covering. Officials are permitted to remove face coverings while actively officiating the game. No food or drinks, and the capacity within the gymnasiums will be 50% is what we are recommending. We are also recommending that for shows and concerts, we have Christmas programs coming up, that those students participating in the actual show at that time can remove masks, and that the capacity would be 50% to be able to come into, whether it's the cafeteria or the gymnasium or an auditorium, depending on which school those events take place. So I'll take any questions through the recommendations at this point. We obviously will be meeting with principals and going over some of the procedures to be able to put this in place. But what you're approving tonight is us to be able to move forward to make those changes for the winter athletics and winter extracurricular activities.
Are there any questions for Mr. Blank? Ms. Fraley?
So on the buses, before that was a CDC, I think, or some level higher than the state. Is it now that we are able to do that because that has been lifted?
Yes, in talking with the Maryland Department of Health, there are different options, and we are choosing that option within collaboration of the health department on what we've deemed to be the safest. So at this point, if we treat it like a classroom, that's what the option that we've chosen to be able to move forward, because it's consistent with what we're doing in our county. And our numbers obviously have been going down with the metrics as far as students who are quarantined, and this will enhance that number, or decrease that number, I should say.
Will this take effect immediately, or the date, or is it different dates? Will winter sports take effect on the first day of practice and then so on?
Yes, we'd like for the extracurriculars to begin on November 15th. We'd like for the buses to begin tomorrow, so that our administrators, our students who are on those buses, we can put that in effect tomorrow if it gets approved this evening. And you're correct, our first practice day is the 15th. So to keep everybody on the same page, we were thinking everything else will begin on the 15th, which is next week.
Mr. Farrell, do you have a question?
I was just going to make a motion to accept Mr. Blank and the staff's recommendation on this so that we have it on the floor.
Thank you. Is there a second?
Second.
Second by Ms. Fraley. Any other discussion or questions for Mr. Blank? Okay, all those in favor? Motion passes unanimously. Thank you. At this time, I believe Mr. Wilson or Ms. Matheny will be coming forward for the school calendar adjustment.
Good evening. On behalf of Dr. Caldwell, who couldn't be here tonight, I'm going to make a request for you folks. For Dr. Caldwell, she is requesting your consideration and approval to modify the school calendar so that we can provide some in-school training and support to teachers. The extra time will help with the implementation of the new textbook series, strategies, and a review of diagnostic data and how to address instructional gaps. It will also give teachers an additional hour of planning on both of these dates. So on Monday, December 6th, and on Monday, March 21st, we would like to have a 3-hour delayed opening with 2 hours of supervisor staff development, which will be held virtually, and 1 hour of teacher planning. Presently, the school calendar already has Tuesday, January 18th as supervisor staff development, teacher work time. We appreciate your consideration in this matter.
Do you mind repeating the dates one more time? You said December 6th and March.
Yes, it's December. Monday, December 6th, and Monday, March 21st.
Thank you. Is there a motion to approve the calendar adjustment?
So moved.
Motion by Ms. Frank, second. Second by Ms. Fraley. Any discussion or questions? All those in favor? Motion passes unanimously. Thank you. First reading of parent guardian observation of student policies. Mr. Llewellyn.
So you have before you for first reading a brand new policy, and this would be the parent guardian observation of students policy. It was recommended that we have a policy by outside counsel. You're familiar with Rochelle Eisenberg, based on recent litigation. And so what this policy allows for the regulation of parents coming in to the classroom to observe. And so there's a policy, and next we're going to talk about a regulation of the policy. But this says that observations by parents and guardians are permitted so long as the observations do not interfere with the learning environment or the privacy of other students. And this will be the first reading tonight. Next, you have the regulation, the proposed regulation for this policy. Again, all of it's brand new, but recommended by our outside counsel. And this basically lays out the procedure and the guidelines for how these observations can occur. It puts some limitations on it, and just regulates how it will happen. Are there any questions regarding the regulation? Okay. So unless there's a rejection of the regulation, it's a review, and it'll stand as soon as the policy passes second reading. Okay, thank you. Next on the agenda, we have policy file IKAR2.
I'd like to make a motion to table discussion about that policy until the December board meeting.
Is there a second?
Second.
Second by Ms. Fraley. All those in favor? Motion passes unanimously. Thank you. At this time, can we have a motion to to meet in executive session on December 7th, 2021?
So moved.
Motion by Mr. Farrell, second. Second by Dr. Bond. All those in favor? Passes unanimously. Thank you. Student member of the board update. Ms. Noel, do you have anything for us this evening?
Yes, I do. Just something brief. I spoke a little bit last time about our Allegheny County Association of Student Councils Executive Board. We conducted elections and all of our positions are established. They met on November 2nd to have a general meeting. I was unfortunately unable to make it to that meeting, but at this meeting they discussed issues regarding individual schools and they're planning our first General Assembly, which will be probably around midwinter. We also discussed, or they also discussed, the MASC Fall Leadership Conference and a possible partnership with Allegheny College and Civic Education Coalition to host a youth summit in the future. Besides that, I would like to keep this very brief, not to resurface anything, but Fort Hill community has obviously suffered a very tragic loss. I'm speaking not to resurface this trauma, but to rather commemorate those who have supported the community, the Fort Hill community, during this trying time. I know many have struggled recently, but the support that we've gotten from not only other schools, but the community in general has been amazing. And I think I speak for many when we say thank you to everyone who supported us. It's not easy, and we'll push through this, but I would just like to thank everyone who has supported Fort Hill. That's all I have.
Thank you very much. Are there any board member updates? Ms. Frank?
I was remiss in October's meeting in mentioning that Mr. Blank, Mrs. Bender, Mr. Llewellyn, Ms. Fraley, and I attended the MABE Fall Conference. It was a very valuable experience. Mr. Blank and I got to sit and have dinner with the president of the board for Maryland State Department of Education. So it was very enlightening. But even more than that, it was the end of the tenure for Mrs. Fraley as the MABE president, and we've never had somebody from Allegheny County in that role. And I just want to say thank you, and you served this community well. Thanks.
Thank you, Ms. Frank. Ms. Fraley?
I would just like to note that the state board meetings are being live streamed, and they are very interesting to watch. And I know the mask mandate from the state level is interesting to many people. Their next board meeting is on December 7th. Their meetings usually go from 9 till around 1, and then they take a lunch break. So you can watch it online, or you can go to Baltimore. But they do have on their agenda to discuss their revisiting of their regulation that they put out, and what their plan is from a state level. That's all.
Thank you, Ms. Fraley. Any other board member updates? Mr. Blank?
I just wanted to close with a thank you to Chief Turnett and all his assistants and his staff during one of the most difficult times we've had. His support and guidance was tremendous help for us as we're working our way through this. So thank you, Chief Turnett.
Okay, at this time, if there are no other board member updates, we will vote to adjourn. Is there a motion for adjournment?
So moved.
Ms. Fraley, second? Second by Mr. Farrell. All those in favor? Thank you very much. Have a good evening.